Welcome, future nurses. You have officially arrived at day 21 of our unstoppable 30-day NCLEX challenge, and that deserves a huge round of applause. That is right. You have already conquered 20 full-length NCLEX practice tests, and by now, your critical thinking muscles are sharper than ever. Together, we are tackling 2,000 of the most high-yield, priority-packed, exam-repeating questions that show up again and again on the real NCLEX. The kind that separates those who pass from those who dominate. Every single test you complete takes you one step closer to that nursing license, and practice test 21 is about to push you even further. But before we dive into today's clinical question battle, I have got an exciting gift for you. And yes, it is completely free. For a limited time, we are offering 5 days of free access to our complete NCLEX crash course. No credit card, no commitment, just pure prep power. All you need to do is click the WhatsApp link in the description and send the word "Hi." That is it. Our team will instantly unlock your access to live and recorded NCLEX review sessions, next-gen NCLEX case study walkthroughs, over 5,000 real exam-style questions, PDF study guides and cheat sheets, personalized 1-week and 1-month study planners, and full support from our expert NCLEX educators. And here is the best part. You have nothing to lose and everything to gain. These 5 free days might be exactly what you need to crush the exam and change your future. So do not miss out. Now, get ready to power up that brain, close your tabs, silence your phone, and let us dive into practice test 21. Another round of test-ready, clinical, scenario-packed NCLEX questions designed to get you licensed faster. Let's go. Let us begin with a high-yield safety and pharmacology question 1. The nurse is caring for a client who is scheduled for a contrast-enhanced computed tomography scan. After the procedure, which medication should the nurse ensure is temporarily withheld? The options are as follows. Option A, labetalol. Option B, metformin. Option C, levodopa. And option D, ondansetron. The correct answer is option B, metformin. Metformin, an oral antidiabetic used for type 2 diabetes, should be temporarily withheld for at least 48 hours after contrast exposure due to the risk of contrast-induced nephropathy. If kidney function is impaired, metformin may accumulate and lead to lactic acidosis, a rare but potentially fatal complication. Let us move on to a clinical decision-making question focused on risk prevention. Question 2. The nurse is reviewing a client's data. Hemoglobin. A1C is 5.9%. Total cholesterol is 200 milligrams per deciliter. Blood pressure is 155 over 82 millimeters of mercury. And body mass index is 27. What is the most appropriate nursing action? The options are: Option A, initiate a referral to a registered dietitian. Option B, reassure the client that their results are within expected limits. Option C, recommend a prescription for occupational therapy. And Option D, explore the client's family health history. This client shows multiple red flags for metabolic syndrome, including elevated blood pressure, borderline cholesterol, a pre-diabetic A1C of 5.9%, and an overweight BMI of 27. Early action is key to preventing type 2 diabetes and cardiovascular disease. A registered dietitian can guide personalized dietary changes, reducing sodium, saturated fats, and sugars, while supporting weight loss and healthy lifestyle habits. This proactive referral targets the root risks before they escalate. Now let us look at a question focused on medication safety. Question 3. A nurse is preparing to give enoxaparin to a hospitalized client for venous thromboembolism prevention. Which lab value should be closely monitored during this therapy? The options are: Option A, platelet count. Option B, activated partial thromboplastin time. Option C, international normalized ratio. And Option D, white blood cell count. The correct answer is Option A. Although enoxaparin does not require routine coagulation testing, it can cause heparin-induced thrombocytopenia, a dangerous drop in platelets, often by 50% or more. Monitoring platelet count helps catch this complication early. Next, let us focus on client education and medication safety. Question 4. The nurse is teaching a client how to properly store insulin at home and while traveling. Which client statement shows the teaching has been effective? The options are: Option A, once I open my insulin vial, I can keep it in the freezer to preserve it longer. Option B, My opened vial of insulin is still good for 45 days as long as I seal it tightly. Option C. When I travel, I usually leave my insulin in the car for convenience. And option D. Unopened insulin vials should be stored in the refrigerator to keep them potent. The correct answer is option D. Insulin that is unopened should be stored in the refrigerator between 36 and 46 degrees Fahrenheit to maintain potency until its expiration date. Now, let us look at a question centered on emotional support and therapeutic communication. Question 5. The nurse is speaking with a recently widowed client who is showing signs of severe anxiety, including insomnia, shortness of breath, intense dread, and a sense of impending doom. Which nurse response demonstrates the most effective use of therapeutic communication? The options are: Option A. Just try to relax. You are safe here, and there is no reason to feel anxious. Option B. Can you think of anything that might have triggered these feelings, either recently or in the past? Option C. The medication I administered earlier will help reduce your anxiety symptoms. And option D. Why not try taking a few deep breaths? That should help calm you down. The correct answer is option B. This open-ended and non-judgmental response invites the client to explore their emotions in a safe space, helping build trust and offering insight into the cause of their anxiety during a vulnerable time like grief. Quick break, future nurses. I have got something you do not want to miss. If you are loving these NCLEX questions and want to fast-track your prep even further, here is a game changer. We are giving you 5 full days of free access to our complete NCLEX crash course. And yes, it is 100% free. No payment, no commitment. Just serious NCLEX prep power in your hands. Click the WhatsApp link in the description and type "Hi." That is all it takes. You will instantly unlock access to live and recorded NCLEX review classes, next-gen NCLEX case studies, over 5,000 exam-style questions, printable study guides, custom weekly and monthly planners, and personal Q&A support from expert NCLEX coaches. Take the guesswork out of your prep and make these next 5 days count, because your nursing license is calling. Now, let us get back to those practice questions and keep crushing it. Next, let us review a prioritization question focused on medication safety. Question 6. The nurse is triaging multiple client phone calls at a busy outpatient clinic. Which client concern warrants the most urgent notification to the healthcare provider? The options are: Option A. A client taking metronidazole who reports a strong metallic taste in the mouth. Option B. A client recently prescribed sulfamethixazole trimethoprim who reports a mild rash on the arm. Option C. A client on long-term lithium therapy who is now experiencing blurred vision. And option D. A client taking prednisone who reports restlessness and difficulty sleeping. The correct answer is option C. Blurred vision in a client taking lithium may signal lithium toxicity, a dangerous condition that requires immediate evaluation. Lithium has a narrow therapeutic range, typically between 0.6 and 1.2 milliequivalents per liter. Toxic levels, especially above 2.0, can cause neurological symptoms like confusion, ataxia, and even seizures. Now let us review a discharge teaching question related to fluid balance and endocrine care. Question 7. The nurse is providing instructions to a client recently diagnosed with chronic diabetes insipidus. Which client statement demonstrates correct understanding of how to monitor for complications at home? The options are: Option A. I should limit myself to drinking no more than 800 milliliters of fluid per day. Option B. I will check my weight every morning at the same time using the same scale. Option C. To stay hydrated, I should add extra salty snacks to my diet. And option D. I will keep a record of how much fluid I drink each day. The correct answer is option B. In diabetes insipidus, daily weight monitoring is the most reliable method to assess fluid status. Weighing each morning, after the first void, and with the same scale, helps detect subtle changes in volume loss or retention, which are common due to excessive urination and lack of antidiuretic hormone. Now, let us test your ability to differentiate between left-sided and right-sided heart failure. Question 8. The nurse is assessing a client diagnosed with systolic heart failure. Which clinical finding is most consistent with right-sided heart failure? The options are: Option A, ascites; Option B, tachypnea; Option C, cough; and Option D, orthopnea. The correct answer is Option A. Ascites, or fluid buildup in the abdomen, is a classic finding in right-sided heart failure. It results from venous congestion caused by the right ventricle's inability to pump blood efficiently into the lungs, leading to systemic fluid accumulation. Now let us look at a medication emergency involving the eyes. Question 9. A client with acute angle closure glaucoma needs rapid reduction of intraocular pressure. Which medication should the nurse anticipate? The options are Option A, acetazolamide, Option B, diphenhydramine, Option C, phenylephrine, and Option D, nortriptyline. The correct answer is Option A. Acetazolamide reduces aqueous humor production, quickly lowering pressure and preventing optic nerve damage. In this condition, intraocular pressure often rises above 30 millimeters of mercury and can lead to blindness if not treated promptly. Now let us shift to an endocrine assessment scenario. Question 10. The nurse is evaluating a client who reports frequent diarrhea, unintentional weight loss, anxiety, and restlessness. A thyroid function panel is ordered. Based on these symptoms, the client is most likely at risk for which condition? The options are Option A, myxedema, Option B, Bell's palsy, Option C, Graves's disease, and Option D, Cushing syndrome. The correct answer is Option C. These symptoms are classic signs of hyperthyroidism, most often caused by Graves's disease, an autoimmune condition that leads to excessive thyroid hormone production and a hypermetabolic state. Now let us shift focus to protecting client information in a digital healthcare environment. Question 11. When evaluating threats to information security, which poses the most frequent and preventable risk to client health data? The options are Option A, cyber attacks conducted by foreign governments. Option B, ransomware attacks initiated by domestic hackers. Option C, employees failing to log off systems and sharing passwords. And Option D, large-scale electrical power outages within the facility. The correct answer is Option C. The most common and avoidable security threat is internal human error, especially when employees fail to log out of systems or share their passwords. These actions put protected health information at risk and can result in serious privacy violations. Now, let us explore a cardiovascular question based on chest pain patterns. Question 12. A nurse is assessing a client who reports recurring chest pain that happens at the same time every day, even while resting, and is not triggered by stress or exertion. Which type of angina is the client most likely experiencing? The options are Option A, variant angina, Option B, stable angina, Option C, unstable angina, and Option D, non-anginal chest pain. The correct answer is Option A. Variant angina, also called Prinzmetal's angina, involves chest pain at rest, often occurring predictably, typically in the early morning. It is caused by temporary coronary artery spasms that restrict blood flow, even in clients without significant atherosclerosis. Now let us tackle a dosage calculation question involving a high-alert medication. Question 13. The nurse is caring for a client receiving a continuous intravenous infusion of heparin. The intravenous bag is labeled as containing 25,000 units of heparin in 500 milliliters of 5% dextrose in water. The client is prescribed 1,500 units of heparin per hour. How many milliliters of the infusion will the client receive over an 8-hour nursing shift? The correct answer is 240 milliliters. Here is the calculation. First, determine the rate in milliliters per hour using the formula dose ordered divided by dose available multiplied by the volume. So 1,500 divided by 25,000 times 500 milliliters equals 30 milliliters per hour. Then multiply that by 8 hours. 30 times 8 equals 240 milliliters. Now let us examine a question about psychosocial assessment and emotional coping. Question 14. The nurse is evaluating a client recently diagnosed with ovarian cancer. Which statement suggests the client may be demonstrating ineffective coping and could benefit from further psychological support? The options are Option A, I recently started attending a community support group for women with cancer. Option B, I do not fully understand what my long-term prognosis looks like. Option C, since starting radiation, sexual activity has become very uncomfortable for me. And Option D, lately, I have been sleeping a lot more and have lost my appetite. The correct answer is Option D. Excessive sleep and appetite loss are classic signs of emotional withdrawal or depression, and may indicate that the client is not coping well with the diagnosis. Next, let us look at a behavioral health scenario involving a defense mechanism. Question 15. A client on the behavioral health unit reports sudden blindness after witnessing a traumatic motor vehicle accident. Medical evaluation shows no physical or neurological cause. Which defense mechanism is most likely being used? The options are Option A, suppression, Option B, conversion, Option C, displacement, and Option D, dissociation. The correct answer is Option B. Conversion involves the unconscious transformation of emotional distress into physical symptoms, such as blindness or paralysis, with no medical explanation. In this case, the client's psychological trauma is being expressed physically through vision loss. Quick pause. Future RN or LPN. If you are feeling the pressure, do not worry. We have your back. For a limited time, you can get 5 days of free access to our complete NCLEX crash course. Just click the WhatsApp link below and message "Hi." That is it. We will instantly unlock live NCLEX masterclasses, over 5,000 exam-style questions, case study walkthroughs, printable study guides, personalized planners, and so much more. No payment, no pressure, just pure prep. Jump in now and let us supercharge your NCLEX journey. Now, let us look at a mobility and safety question involving assistive devices. Question 16. The nurse is observing a client using a standard walker during ambulation. Which observed behavior requires intervention to ensure the client's safety? The options are Option A, the client advances the walker approximately 6 to 10 inches forward before stepping. Option B, the client maintains an elbow flexion of about 15 to 30 degrees while gripping the walker. Option C, the client tilts the walker forward while attempting to rise from a seated position. And Option D, the client advances the walker and then steps forward with the weaker leg first. The correct answer is Option C. Tilting the walker forward to push up from a chair is unsafe and can lead to instability or falls. Instead, clients should push up from the armrests of the chair, then grasp the walker only after fully standing. Next, let us review a critical prioritization question related to disaster triage. Question 17. Following a multiple casualty bus accident, the nurse must determine which client requires the highest priority for immediate transport to the trauma center. The options are Option A, a client with right forearm pain and visible swelling, but with an intact distal pulse and normal sensation. Option B, a client who is unresponsive, not breathing, and bleeding heavily from a deep chest wound. Option C, a client with a crushed leg who reports no sensation and has no detectable distal pulse. And Option D, a client who is alert but visibly anxious, with abrasions on both arms. The correct answer is Option C. This client has impaired circulation and sensation in the affected limb, which signals a red tag priority. Without urgent intervention, the client risks ischemia, sepsis, or limb loss, making immediate treatment essential. Now let us consider a safety-focused prioritization question in a behavioral health setting. Question 18. The nurse is caring for 4 clients. Which one should be assessed and intervened with first? The options are Option A, a client who is repeatedly washing their hands throughout the shift. Option B, a client who frequently interrupts others during group therapy. Option C, a client who is shouting aggressively and yelling at other clients in the day room. And Option D, a client who was voluntarily admitted and is now requesting to leave the facility. The correct answer is Option C. Aggressive and loud behavior poses an immediate safety threat. This client is at risk of escalation, which could endanger themselves or others. Immediate de-escalation or removal from the area is a top priority. Now, let us review a health promotion question related to sleep hygiene in older adults. Question 19. During a group teaching session, which participant statement indicates a need for further education? The options are Option A, using nicotine replacement gum at night might keep me awake. Option B, I try to limit my daytime naps to about 30 minutes or less. Option C, I find that reading a book before bed helps me relax and fall asleep. And Option D, drinking a cup of hot green tea before bedtime helps calm me down. The correct answer is Option D. Although green tea may feel relaxing, it contains caffeine, a stimulant that can interfere with falling and staying asleep. This is especially important for older adults who are already vulnerable to sleep disturbances. Question 20. Now, let us take a look at a prioritization question involving multiple clients in the emergency department. Based on Maslow's hierarchy, the ABC framework, and urgency of intervention, in what order should the nurse complete the following tasks? The tasks include assessing blood pressure for a client receiving dopamine infusion, inserting a peripheral IV and starting fluids for mild dehydration, performing wound care for a client being discharged, witnessing informed consent for a client scheduled for surgery in 6 hours, and administering magnesium sulfate to a client with status asthmaticus. The correct order is, first, administer magnesium sulfate for status asthmaticus, as this is a life-threatening airway emergency requiring immediate action. Second, assess blood pressure in the client on dopamine, since this vasopressor affects circulation and must be closely monitored. Third, insert the IV and begin fluids for mild dehydration, important but not urgent. Fourth, witness informed consent for surgery, which is time-sensitive but not life-threatening. Fifth, perform wound care for the discharged client, which is the lowest priority since the client is stable. Next, let us review a pediatric assessment question involving heart failure. Question 21. The nurse is evaluating a child recently admitted with congestive heart failure. Which finding would be expected as a typical clinical manifestation? The options are Option A, pulse deficit, Option B, exercise intolerance, Option C, bradypnea, and Option D, flattened neck veins. The correct answer is Option B. Exercise intolerance is a hallmark sign of pediatric heart failure, reflecting the heart's inability to meet oxygen demands during activity. Children may show early fatigue, shortness of breath, or refusal to play. In infants, this often appears as difficulty feeding or poor weight gain. Now, let us turn to a developmental question during a well child visit. Question 22. The nurse assesses a 12-month-old infant and notes that the anterior fontanelle remains slightly open. The parent expresses concern. What is the most appropriate response by the nurse? The options are Option A, I will contact the healthcare provider immediately to evaluate further. Option B, I need to do more assessments to determine what is going on. Option C, we will likely need to obtain an MRI to investigate this further. And Option D, it is normal for a child this age to still have an open anterior fontanelle. The correct answer is Option D. The anterior fontanelle typically closes between 12 to 18 months of age, so it is completely normal for it to remain slightly open at 12 months. The nurse should reassure the parent that this is within expected developmental limits. Now let us review a critical care decision. Question 23. A client with severe sepsis remains hypotensive despite adequate fluid resuscitation and is on vasopressor therapy. What should the nurse anticipate next? The options are Option A, administer an additional bolus of crystalloid solution. Option B, initiate continuous renal replacement therapy. Option C, titrate the current vasopressor infusion upward. And Option D, administer a blood transfusion. The correct answer is Option C. When fluids are no longer effective, the vasopressor dose must be increased to maintain a mean arterial pressure of at least 65 millimeters of mercury and ensure adequate organ perfusion. Next is a triage decision involving client phone reports. Question 24. Which client requires the most urgent notification to the provider? The options are Option A, a client with heart failure who reports gaining 3 pounds overnight. Option B, a client on peritoneal dialysis who has not had a bowel movement in 2 days. Option C, a client with irritable bowel syndrome having frequent diarrhea. And Option D, a client with nephrolithiasis reporting bloody urine and flank pain. The correct answer is Option A. A 3-pound weight gain in 24 hours suggests fluid overload and possible heart failure decompensation, requiring immediate provider action. Now let us look at a teaching question involving diagnostic preparation. Question 25. The nurse is educating a client scheduled for intravenous urography. Which client statement shows correct understanding of the pre-procedure instructions? The options are Option A, I should expect to have a temporary urinary catheter inserted during the procedure. Option B, I will take a laxative the night before to help clear my bowels. Option C, I need to drink water to fill my bladder just before the test. And Option D, it is normal to have blood in my urine for a few days after this procedure. The correct answer is Option B. Bowel prep with a laxative is necessary the night before to prevent fecal matter or gas from interfering with the imaging of the urinary tract. Hey, real quick. While you are slaying these questions, imagine this. What if you had full access to everything you need to pass the NCLEX in one place? Well, you can. And it is 100% free for 5 days. Just click the WhatsApp link below, say, "Hi," and you are in. You will get expert-led review classes, 5,000 plus NCLEX questions, NGN case studies, printable cheat sheets, and personalized study plans. No hidden fees, just high-impact prep. Go get it and come right back. We will keep your spot warm. Now, let us shift to a newborn care question. Question 26. The nurse is reviewing routine post-delivery procedures with a new parent and explains that vitamin K is given to all newborns. What is the primary reason for this intervention? The options are option A, because neonates are unable to synthesize vitamin K in the intestines without established bacterial flora. Option B, due to hemolysis resulting from hepatic immaturity. Option C, because of decreased vitamin B12 storage after birth. And option D, due to reduced iron storage in the liver and spleen. The correct answer is option A. Newborns are born with sterile intestines and cannot produce vitamin K, which is essential for clotting. Without supplementation, they are at risk for serious bleeding, including life-threatening intracranial hemorrhage. Now, let us review a prioritization scenario during shift handoff. Question 27. The nurse receives a report on 4 clients. Which one should be assessed first? The options are option A, a client with chronic obstructive pulmonary disease and respiratory acidosis confirmed by arterial blood gas. Option B, a client with atrial fibrillation taking warfarin who reports black, tarry stools. Option C, a client with diabetes who received glargine insulin and is now refusing to eat. And option D, a client with acute pancreatitis reporting nausea and epigastric pain rated 3 out of 10. The correct answer is option B. This client is on anticoagulation therapy and showing signs of gastrointestinal bleeding, indicated by black, tarry, stools. This may represent upper GI hemorrhage and demands immediate assessment and intervention. Next, let us review an emergency scenario involving seizure management. Question 28. The nurse observes a novice nurse caring for a client in status epilepticus. Which action requires immediate intervention? The options are option A, prepares to administer intravenous valproate to stop the seizure. Option B, places the client in a lateral side-lying position. Option C, activates the rapid response team. And option D, loosens tight or restrictive clothing around the client's neck and chest. The correct answer is option A. While valproate is useful as a second-line agent to prevent further seizures, it is not effective for stopping an active seizure. The first priority is rapid administration of a benzodiazepine such as lorazepam or diazepam. Now, let us focus on endocrine education. Question 29. During a seminar on Cushing's disease, which statement correctly identifies the underlying cause? The options are option A, it results from destruction of pancreatic beta cells. Option B, it is caused by excessive secretion of thyroid-stimulating hormone. Option C, it occurs due to a deficiency in androgens and glucocorticoids. And option D, it is caused by increased secretion of adrenocorticotropic hormone. The correct answer is option D. Cushing's disease specifically refers to cortisol excess caused by a pituitary adenoma that increases secretion of adrenocorticotropic hormone, or ACTH. This overproduction stimulates the adrenal glands to release excess cortisol, leading to symptoms like central obesity, moon face, and hypertension. Now let us review a communication-focused discharge question. Question 30. The nurse is preparing to give instructions to a client who does not speak English. Several English-speaking family members are present, but the client only understands their native language. What is the most appropriate action? The options are option A, use a smartphone translation application. Option B, provide printed discharge materials in the client's language while explaining them in English. Option C, request a professional medical interpreter through the hospital's language assistance services. And option D, simplify the information and ask the family to translate. The correct answer is option C. A certified medical interpreter ensures that discharge instructions are communicated accurately, safely, and in compliance with legal and ethical standards. This supports informed decision-making and prevents misunderstandings that could lead to complications. Next up is a pediatric scenario involving school-age safety. Question 31. The school nurse evaluates a 6-year-old student after the teacher expresses concern. Which observation should prompt the nurse to investigate for possible neglect? The options are Option A, difficulty paying attention in class. Option B, feeling hungry a few hours after lunch. Option C, being more shy than peers. And Option D, frequent absences and appearing tired. The correct answer is Option D. Chronic school absenteeism combined with signs of fatigue may signal unmet basic needs, such as inadequate sleep, supervision, or nutrition, all of which point toward possible physical neglect. This finding should not be overlooked and warrants further assessment and potential reporting. Let us move on to an important topic in post-operative care, skin integrity. Question 32. The nurse is creating a care plan for a client at high risk for pressure ulcers. Which intervention best supports skin protection and injury prevention? Your options are Option A, apply sequential compression devices. Option B, add an extra sheet to reduce friction. Option C, use a donut-shaped cushion. Or Option D, encourage a protein-rich diet. The correct answer is Option D. Encouraging the intake of protein-rich foods promotes tissue repair and skin resilience, both essential for preventing pressure injuries. Adequate protein also supports collagen production and reduces edema, making it a cornerstone of pressure ulcer prevention in at-risk clients. Moving on to safe medication administration, question 33. The nurse reinforces intramuscular injection techniques. The options are Option A, aspiration before injecting IM medications is no longer considered necessary in all cases. Option B, medications injected into the deltoid muscle absorb more slowly than those in gluteal muscles. Option C, telling a client the injection will not hurt helps ease anxiety. And Option D, the dorsogluteal muscle remains the preferred site for adult IM injections. The correct answer is Option A. Aspiration is no longer routinely required for IM injections in low-risk sites like the deltoid or vastus lateralis, as supported by CDC and WHO guidelines. Let us look at a postpartum scenario. Question 34. The nurse is caring for 4 clients who are each 1 day postpartum. Which finding requires the nurse's immediate attention? The options are Option A, mild uterine cramping. Option B, pulse rate of 65 beats per minute. Option C, bilateral breast colostrum leakage. And Option D, red foul-smelling vaginal discharge. The correct answer is Option D. Foul-smelling lochia is not normal and suggests a possible uterine infection such as endometritis. This condition requires immediate assessment, including checking for fever, uterine tenderness, and notifying the healthcare provider for potential antibiotic initiation. Here is a high-yield endocrine question. Question 35. The nurse is caring for a client recently diagnosed with syndrome of inappropriate antidiuretic hormone, SIADH. Which condition is most commonly linked to its development? The options are Option A, small cell lung cancer. Option B, tumor on the adrenal medulla. Option C, inflammation in the nephron. And Option D, beta cell destruction in the pancreas. The correct answer is Option A, small cell lung cancer. This malignancy can produce ectopic antidiuretic hormone, leading to water retention and dilutional hyponatremia. Hallmarks of SIADH. Hold up! If you are serious about passing the NCLEX fast, do not skip this. We are giving 5 days of free access to our all-in-one NCLEX crash course. Live classes, real exam questions, NGN case studies, study guides, all included. Just click the WhatsApp link below and message us, "Hi, you are 5 days away from a whole new level of confidence. Why wait?" Pause for 30 seconds, grab your access, and let us keep going strong. Let us now shift our focus to psychosocial care. Question 36. The nurse is assessing a client with congestive heart failure who is showing signs of ineffective coping. What is the best nursing intervention to support their psychosocial needs? The options are Option A, recommend participation in a local support group. Option B, provide education on low-sodium dietary choices. Option C, review the client's immunization history. And Option D, suggest the client begin taking St. John's wort supplement. The correct answer is Option A, recommend participation in a local support group. Support groups help clients process emotions, share experiences, and build resilience when managing a chronic condition like heart failure. Now shifting to early parenting concerns, question 37. A parent of a 2-month-old tells the nurse, "I have heard that picking my baby up every time they cry will spoil them." What is the best nursing response to support healthy infant development? The options are A. Wait before picking the baby up to avoid spoiling them. B. Cuddling and comforting does not spoil the baby. It builds trust. C. Feed the baby right away because crying always means hunger. And D. Let the baby cry until they tire themselves out. Correct. Answer is option B. Cuddling and comforting does not spoil the baby. It builds trust. Here is the rationale. Responding promptly helps the infant feel safe and secure, forming a foundation for emotional development. Crying is their only way to communicate, and consistent comfort teaches them that their needs will be met. Now, let us turn to the topic of confidentiality in HIV testing. Question 38. A client tells the nurse they want to be tested for human immunodeficiency virus, but do not want their identity disclosed. Which method should the nurse recommend to ensure complete anonymity? The options are A. HIV home self-testing, B. Rapid testing at the primary healthcare provider's office, C. Inpatient antibody testing, or D. Community health fair rapid testing. Correct. Answer is option A. HIV home self-testing. Here's the rationale. Home self-testing provides the highest level of anonymity, since it allows clients to test privately without linking results to medical records or public health databases. These over-the-counter kits can be purchased online or at pharmacies and typically use an oral swab or finger stick with a unique identifier. Let us now focus on advocacy in prenatal care. Question 39. A pregnant client at a prenatal clinic tells the nurse she plans to formula feed her baby after birth. Which nursing action best demonstrates effective patient advocacy in this situation? The options are A. Emphasize that breastfeeding is the superior method. B. Recommend a consultation with a lactation specialist. C. Assess the client's current understanding of infant feeding options. And D. Respect the client's decision and avoid discussing it further. Correct answer is option C. Assess the client's current understanding of infant feeding options. Here is the rationale. Advocacy means supporting informed, client-centered decisions. By assessing the client's understanding, the nurse ensures that her choice is based on accurate information, not assumptions or misinformation. This approach empowers the client and promotes autonomy. Let us now look at dental care during pregnancy. Question 40. A pregnant client in her 4th month asks the nurse if it is safe to have a scheduled dental extraction next month. What is the most appropriate response? The options are A. The 2nd trimester is the safest period for dental extractions. B. Wait until after delivery. C. Wait until the 3rd trimester. Or D. Take antiviral medication before the procedure. Correct answer is option A. The 2nd trimester is the safest period for dental extractions. Here is the rationale. The 2nd trimester is ideal for non-urgent procedures because fetal development is stable and maternal comfort is better. Let us now turn to post-dialysis priorities. Question 41. A client with end-stage renal disease has just completed their first hemodialysis session. Which finding requires the highest priority follow-up? The options are A. Headache and nausea. B. Scant blood at the arteriovenous fistula site. C. Potassium level of 3.7 milliequivalents per liter. And D. Hemoglobin of 8.8 grams per deciliter. Correct. Answer is option A. Headache and nausea. Here is the rationale. These symptoms may indicate dialysis disequilibrium syndrome, a potentially serious neurologic complication caused by rapid solute shifts leading to cerebral edema. Early recognition is key to prevent progression to seizures or coma. Now let us review fetal well-being during pregnancy. Question 42. A primigravida client undergoes a non-stress test, and the result is documented as reactive. Based on this finding, what action should the nurse take? The options are A. Inform the client of the normal finding. B. Prepare the client for a contraction stress test. C. Arrange for a repeat test. And D. Inquire if the client ate before the test. Correct. Answer is option A. Inform the client of the normal finding. Here is the rationale. A reactive non-stress test indicates a healthy fetal response, showing good oxygenation and intact neurological function. No further testing is needed at this time. Now, let us consider pain assessment in trauma care. Question 43. A client with a recent left tibial fracture is grimacing and slightly diaphoretic during assessment. What is the most appropriate initial nursing action? The options are A. Perform range of motion exercises, B. Obtain the client's temperature, C. Assess the client for pain, and D. Administer prescribed oxycodone acetaminophen. Correct. Answer is option C. Assess the client for pain. Here is the rationale. The client is showing classic nonverbal signs of pain, and the nurse's first step must be a thorough pain assessment. Pain is a vital sign and must be evaluated before any intervention. Next, let us prioritize medication administration across multiple clients. Question 44. The nurse reviews new prescriptions for 4 patients. An 82-year-old with community-acquired pneumonia prescribed levofloxacin, a 35-year-old with gastroenteritis prescribed normal saline, a 27-year-old with diabetic ketoacidosis prescribed metoclopramide, and a 58-year-old with urolithiasis prescribed ketorolac. Which prescription should the nurse prioritize and administer first? The options are A. Levofloxacin intravenous for pneumonia, B. Intravenous fluids for gastroenteritis, C. Metoclopramide for diabetic ketoacidosis, or D. Ketorolac for urolithiasis. Correct answer is option A. Levofloxacin 750 mg intravenous piggyback every 12 hours. Here is the rationale. Pneumonia in elderly clients can escalate rapidly into sepsis or respiratory failure. Early antibiotic therapy is time-sensitive and directly targets the underlying infection. Now let us explore early physical indicators of pregnancy. Question 45. During an initial prenatal assessment, the nurse observes Chadwick's sign. Which finding is associated with this clinical sign? The options are A. A blue to purplish hue of the cervix, B. Softness of the uterine fundus felt through the abdomen, C. Thinning and shortening of the cervix, or D. Absence of menstruation on day 28 of the cycle. Correct answer is option A. A blue to purplish hue of the cervix. Here is the rationale. Chadwick's sign is a probable sign of pregnancy marked by a bluish or purplish discoloration of the cervix, vagina, and labia. It typically appears around 6 to 8 weeks of gestation due to increased blood flow and venous congestion. Let us pause for just a moment, because you deserve every bit of support on this journey. Right now, we are offering you free 5-day access to the NCLEX crash course that has helped thousands of students pass with flying colors. Want in? Click the WhatsApp link in the description, say hi, and we will unlock next-gen case studies, live coaching, 5,000 plus questions, custom planners, and downloadable notes. This is your chance to study smarter, not harder. Now, let us shift to developmental psychology. Question 46. While assessing a 2-year-old child, the nurse considers Erikson's stages of development to guide care planning. According to Erikson's theory, which developmental stage applies to this age group? The options are A. Autonomy versus shame and doubt, B. Industry versus inferiority, C. Trust versus mistrust, and D. Initiative versus guilt. Correct answer is option A. Autonomy versus shame and doubt. Here is the rationale. This stage occurs between 18 months and 3 years, when toddlers begin asserting independence in tasks like toileting, dressing, and feeding. Success fosters confidence and autonomy, while excessive criticism or control can lead to shame or self-doubt. Now, let us review safe food introductions for infants. Question 47. A nurse is educating the parent of a 7-month-old about appropriate dietary choices. Which food is most suitable at this stage? The options are A. Cow's milk, B. Apple juice, C. Soy-based yogurt, and D. Flavored sports drinks. Correct answer I is option C. Soy-based yogurt. Here's the rationale. Unsweetened. Fortified soy-based yogurt is a safe, protein-rich option for infants starting solids. Now, let us shift to mental health assessment. Question 48. While evaluating a client recently diagnosed with post-traumatic stress disorder, which clinical finding is the nurse most likely to observe? The options are A. Delusions of grandeur, B. Hypervigilance, C. Circumstantial speech, and D. Flight of ideas. Correct answer is option B. Hypervigilance. Here is the rationale. Hypervigilance is a classic symptom of post-traumatic stress disorder. Clients often appear tense, easily startled, and constantly alert to danger. This heightened state is part of the hyperarousal cluster of symptoms in PTSD. Let us now move into insulin administration education. Question 49. A nurse is teaching an adolescent newly diagnosed with diabetes mellitus how to self-administer insulin. The client's morning dose includes 8 units of NPH insulin and 8 units of regular insulin. Which statement by the client shows correct understanding of how to draw up the insulin? The options are A. It does not matter which insulin is drawn first. B. The two types cannot be mixed, so separate injections are needed. C. Draw up regular insulin before NPH insulin. And D. Draw up NPH insulin before regular insulin. Correct. Answer is option C. Draw up regular insulin before NPH insulin. Here is the rationale. Regular insulin is clear and short-acting, while NPH is cloudy and intermediate-acting. The correct method, clear before cloudy, ensures the regular insulin is not contaminated, preserving its fast action and effectiveness. Let us now focus on client safety during unit rounds. Question 50. The charge nurse is making routine safety checks. Which client observation requires immediate follow-up due to a potential safety risk? The options are A. A urinary catheter drainage bag secured to the bed frame. B. A client with delirium tremens who has a peripheral vascular access device in place. C. A client with right-sided weakness whose cane is placed on the left side of the bed. And D. A client with a belt restraint fastened across the chest. Correct answer is option D. A client with a belt restraint applied and fastened across the chest. Here is the rationale. Restraints must never be secured over the chest, as this restricts breathing and can cause respiratory compromise. Restraints should be fastened at the waist, allowing for safe immobilization without limiting chest expansion. Next, let us look at infant safety. Question 51. During a SIADH risk screening, which infant is at highest risk? The options are A. A preterm 4-month-old female who sleeps on her back and is formula-fed. B. A preterm 12-month-old male who sleeps on his stomach and is formula-fed. C. A term 6-month-old male who sleeps on his back and is formula-fed. And D. A preterm 3-month-old male who sleeps on his side and is breastfed. Correct answer is option D. A preterm 3-month-old male who sleeps on his side and is breastfed. Here is the rationale. This infant has 4 risk factors: prematurity, male sex, side sleeping, and being in the peak age range for SIADH. While breastfeeding is protective, it does not outweigh the other risks. Let us now explore psychological responses to trauma. Question 52. A client arrives at the emergency department after a traumatic event, but appears calm, composed, and emotionally detached. Which defense mechanism is most likely being used? The options are A. Projection, B. Denial, C. Rationalization, and D. Regression. Correct answer is option B. Denial. Here is the rationale. Denial is an unconscious coping mechanism where the person minimizes or blocks awareness of the trauma to avoid emotional overload. Though the client appears calm, this may be a temporary shield from overwhelming distress. Now, let us move into respiratory assessment priorities. Question 53. A client has just been admitted with pneumonia. Which assessment finding should the nurse prioritize during the initial evaluation? The options are A. Temperature, B. Oral intake, C. Lung sounds, and D. White blood cell count. Correct answer is option C. Lung sounds. Here's the rationale. Pneumonia directly affects the lungs and impairs oxygen exchange. Assessing lung sounds helps the nurse identify adventitious sounds like crackles or wheezing, which signal airway inflammation, fluid buildup, or consolidation, conditions that can quickly lead to respiratory distress. Next, let us focus on medication safety in psychiatric care. Question 54. While reviewing medications for a client with schizophrenia, the nurse notes that the client is prescribed an atypical antipsychotic. Which of the following medications is known to increase the risk of QT interval prolongation and potentially life-threatening arrhythmias? The options are A. Cariprazine, B. Ziprasidone, C. Mirtazapine, and D. Diazepam. Correct. Answer, option B. Ziprasidone. Here is the rationale. Ziprasidone is a second-generation antipsychotic associated with QT interval prolongation, which can lead to torsades de pointes, a dangerous ventricular arrhythmia. Risk is higher in clients with cardiac conditions, bradycardia, or electrolyte imbalances. Now let us move on to infection control during procedures. The nurse is preparing to insert a nasogastric tube in a hospitalized client. Question 55. Which action should be performed first to ensure infection prevention? The options are A. Rinse the nasogastric tube with warm, soapy water. B. Perform hand hygiene. C. Don sterile gloves. And D. Obtain a computed tomography scan to verify placement. Correct answer, option B. Perform hand hygiene. Here is the rationale. Hand hygiene is always the first and most critical step before any procedure, especially those involving mucous membranes like NGT insertion. It prevents cross-contamination and reduces infection risk. Just a quick break to tell you about a major opportunity. You can now get 5 days of completely free access to our NCLEX crash course. No card, no catch. Just click the WhatsApp link and type "Hi." You will instantly receive live and recorded sessions, printable notes, real NCLEX questions, and NGN training. This free access could be the final boost you need before test day. Go grab it. Then come right back here and keep that momentum going. Up. Now let us address infection control and antibiotic-associated complications. Question 56. An older adult client receiving antibiotic therapy reports frequent, foul-smelling, watery stools. Which action should the nurse take first to help prevent the spread of a possible secondary infection? The options are A. Place the client on contact, enteric precautions. B. Place a surgical mask on the client during transport. C. Place face shields outside the client's room. And D. Keep the door to the client's room closed. Correct answer is option A. Place the client on contact, enteric precautions. Here is the rationale. These symptoms suggest a possible Clostridium difficile infection, a highly contagious spore-forming bacteria spread via the fecal-oral route. Contact enteric precautions must be initiated immediately. This includes gown and gloves for all entries and hand hygiene using soap and water, not alcohol-based gel. Let us now look at medication safety in mood disorder management. Question 57. A nurse is reviewing new prescriptions for a client currently taking lithium for bipolar disorder. Which medication should be questioned and clarified with the healthcare provider due to a potential adverse interaction? The options are A. Venlafaxine, B. Hydrochlorothiazide, C. Gabapentin, and D. Verapamil. Correct answer is option B. Hydrochlorothiazide. Here's the rationale. Hydrochlorothiazide is a diuretic that increases sodium and fluid loss, which can lead to lithium retention by the kidneys and raise the risk of lithium toxicity. Signs of toxicity include nausea, tremors, confusion, and in severe cases, seizures. Now, let us explore psychosocial care at the end of life. Question 58. While supporting a terminally ill client and their family, the nurse recognizes an advantage of the mutual pretense stage. What benefit does this stage provide the client? The options are A. Fully engage in denial, B. Maintain control over family members, C. Project emotions onto others, and D. Preserve a sense of dignity and privacy. Correct answer is option D. Preserve a sense of dignity and privacy during the final stages of life. Here is the rationale. In mutual pretense, both the client and family silently acknowledge the reality of the illness without openly discussing it. This shared unspoken understanding allows the client to maintain emotional boundaries, protect their dignity, and cope privately. Now, let us assess adverse reactions requiring urgent follow-up. Question 59. After administering scheduled intravenous medications, which client should the nurse follow up with immediately? The options are A. A client who received hydromorphone and is now drowsy. B. A client who received metoclopramide and now has involuntary jaw movements. C. A client who received dexamethasone and reports perineal itching. And D. A client receiving nitroglycerin who reports a headache. Correct answer is option B. A client who received metoclopramide and now has involuntary jaw movements. Here is the rationale. Involuntary jaw movements are signs of an extrapyramidal side effect, which can progress to dystonia and airway compromise. This is a serious reaction to metoclopramide and requires immediate treatment with diphenhydramine or benztropine. Now, let us focus on emotional support after major surgery. Question 60. A client with breast cancer who recently had a mastectomy is expressing distress over changes in body image. Which nursing intervention is most appropriate to support the client's self-esteem and coping? The options are A. Encourage the client to focus on the positives in life. B. Provide educational materials on breast reconstruction. C. Offer a support group with others who have had similar experiences. And D. Minimize concerns by reassuring the client their appearance is not significantly different. Correct answer is option C. Offer a support group with others who have had similar experiences. Here's the rationale. Support groups create a safe space for emotional sharing and offer validation, hope, and practical coping strategies from peers who truly understand the experience. Now let us focus on medication priorities in cardiac emergencies. Question 61. A client is diagnosed with an acute myocardial infarction. Which medication should the nurse prioritize requesting to improve outcomes during the acute phase? The options are A. Metoprolol, B. Amiodarone, C. Enalapril, and D. Diltiazem. Correct. Answer, option A. Metoprolol. Here is the rationale. Metoprolol, a beta blocker, should be given within the first 24 hours of an acute myocardial infarction, unless contraindicated. It reduces heart rate, blood pressure, and myocardial oxygen demand, helping to limit infarct size and reduce mortality. Now let us examine peripheral vascular assessment and intervention safety. Question 62. A client presents with weak pedal pulses, hairless lower legs, and a full-thickness wound on the right lateral malleolus, with well-defined margins and minimal drainage. Which intervention is contraindicated for this client? The options are A. Apply thromboembolic deterrent hose. B. Assess the need for smoking cessation. C. Request a physical therapy consult. And D. Obtain an ankle brachial index using a handheld Doppler. Correct answer is option A. Apply thromboembolic deterrent hose to bilateral legs. Here is the rationale. These findings suggest peripheral arterial disease, and applying TED hose can further reduce blood flow to already ischemic tissue, worsening the condition. Now, let us evaluate proper tracheostomy care technique. Question 63. A nurse preceptor is observing a newly hired nurse perform care for a client with a tracheostomy. Which action requires follow-up? The options are A. Applies suction while withdrawing the catheter in a twirling motion. B. Inflates the tracheostomy cuff with 5 milliliters of air before suctioning. C. Pre-oxygenates the client with 100% oxygen. And D. Provides mouth care after suctioning. Correct answer is option B. Inflates the tracheostomy cuff with 5 milliliters of air before suctioning. Here is the rationale. The cuff should already be inflated if indicated. Manually inflating it with a fixed amount before suctioning is not safe and may lead to overinflation and tracheal injury. Cuff pressures must be measured with a manometer to stay within the safe range. Let us now shift our focus to dietary teaching for hypertension management. Question 64. A client recently hospitalized for emergent hypertension is preparing for discharge, and the nurse is educating them about following a low-fat, low-cholesterol diet. Which food choice by the client shows an accurate understanding of this recommendation? The options are A. Macaroni and cheese, B. Fish and chips, C. Turkey breast salad, or D. Pepperoni pizza. Correct answer is option C. Turkey breast salad. Here is the rationale. Turkey breast salad is a lean protein option with minimal saturated fat and cholesterol, especially when served without fried toppings or heavy dressings. This aligns with the principles of the DASH diet, ideal for blood pressure control as it includes lean protein, fresh vegetables, and low sodium. Let us now focus on nutritional therapy monitoring. Question 65. A nurse is caring for a malnourished client who has recently started total parenteral nutrition. Which of the following laboratory values would indicate that the client is responding positively to the therapy? The options are A. Fasting blood glucose of 129 milligrams per deciliter, B. White blood cell count of 12,000 per cubic millimeter, C. Serum albumin of 3.6 grams per deciliter, or D. Urine-specific gravity of 1.040. Correct answer is option C. Serum albumin of 3.6 grams per deciliter. Here is the rationale. Serum albumin is a long-term indicator of protein and nutritional status. A value of 3.6 grams per deciliter falls within the normal range of 3.5 to 5.0 and shows that protein intake and synthesis are improving due to total parenteral nutrition. This indicates the therapy is effective. Studying for the NCLEX can feel overwhelming, but it does not have to be. For a limited time, we are giving you free 5-day access to our complete NCLEX prep course. It is packed with expert-taught review classes, 5,000 plus questions, NGN case studies, weekly planners, and educator support. To get started, just click the WhatsApp link and say, "Hi." No stress, no payment. Just guidance that gets you licensed. Move to next question. Question 66. A client newly diagnosed with peptic ulcer disease is being educated on lifestyle changes and medications. Which statement should the nurse include? The options are: A. You should take aspirin if you have mild aches or pains. B. You will need to consume liquids 1 hour after each meal. C. It will be important to reduce the stress in your life. Or D. Take your prescribed omeprazole with food. Correct answer is option C. It will be important to reduce the stress in your life. Stress can aggravate peptic ulcer symptoms by increasing gastric acid. Teaching clients to manage stress supports healing and improves adherence to treatment. Now, let us look at a client suspected of developing acute respiratory distress syndrome. Question 67. The nurse is reviewing arterial blood gas results to determine which set best reflects worsening, untreated ARDS. Here are the choices. Option A shows a pH of 7.50, a carbon dioxide level of 48, bicarbonate 44, oxygen 70, and an oxygen saturation of 88%. Option B shows a pH of 7.28, carbon dioxide 53, bicarbonate 28, oxygen 55, and oxygen saturation of 82%. Option C displays a pH of 7.36, carbon dioxide 44, bicarbonate 28, oxygen 66, and oxygen saturation of 84%. Lastly, option D reveals a pH of 7.48, carbon dioxide 48, bicarbonate 24, oxygen 70, and saturation of 86%. The correct answer is option B, which clearly indicates respiratory acidosis with severe hypoxemia. Classic findings in progressing ARDS. The low pH and elevated carbon dioxide reflect respiratory failure, while the dangerously low oxygen and saturation levels confirm poor gas exchange. Here is a quick safety-focused scenario. Question 68. The nurse is educating the mother of a child recently diagnosed with a banana allergy. Which of the following substances may also trigger a cross-reaction in this child? The options are A. Penicillin, B. Cat dander, C. Latex, and D. Peanuts. The correct answer is option C. Latex. Banana allergies are linked to latex fruit syndrome due to shared allergenic proteins called chitinases. These proteins are also found in latex, avocado, and kiwi, putting the child at higher risk for latex sensitivity. This makes latex exposure, such as balloons or medical gloves, a potential danger. Let us take a closer look at mechanical ventilation safety in acute respiratory distress syndrome. Question 69. The nurse is monitoring a client on positive end expiratory pressure, or PEEP. Which serious complication should the nurse watch for most closely? The options are A. Hyperventilation, B. Hypotension, C. Barotrauma, and D. Respiratory alkalosis. The correct answer is option C. Barotrauma. This is the most critical complication of high PEEP. PEEP keeps alveoli open for better oxygenation, but if pressure is too high, it can cause overdistension and rupture of the alveoli, leading to dangerous air leaks such as pneumothorax or subcutaneous emphysema. That is why sudden changes in oxygenation or breath sounds must be investigated immediately. Let us now shift our focus to safe medication practices with verbal prescriptions. Question 70. The nurse receives a telephone order for citalopram 10 milligrams by mouth once daily. To ensure client safety and avoid any medication error, what should be the nurse's first action? The options are A. Verify that the medication is available in the unit stock. B. Read the entire prescription back to the healthcare provider for confirmation. C. Notify the client about the newly prescribed medication. And D. Forward the prescription to the pharmacy for processing. The correct answer is option B. Read the entire prescription back to the healthcare provider for confirmation. This step is crucial in preventing miscommunication, especially when verbal or phone orders are used. Reading the order back confirms that the nurse understood the drug name, dose, route, and frequency correctly. This aligns with national safety guidelines and protects against look-alike and sound-alike drug errors. Let us turn our attention to an important aspect of mental health nursing. Question 71. A client recently diagnosed with borderline personality disorder is preparing for discharge and asks the nurse which therapy would best help manage their emotional instability and impulsivity over the long term. The options include A. Behavioral therapy, B. Psychodynamic therapy, C. Interpersonal therapy, and D. Dialectical behavior therapy. The correct answer is option D. Dialectical behavior therapy. Dialectical behavior therapy is specifically designed to treat borderline personality disorder and is backed by strong evidence. It combines cognitive behavioral approaches with mindfulness techniques, helping clients build emotional regulation, distress tolerance, interpersonal skills, and mindfulness. DBT is proven to reduce self-harming behavior, suicidal ideation, and emotional outbursts, making it the most appropriate and effective choice. Let us now look at a key infection control question involving unlicensed assistive personnel. Question 72. The nurse is supervising a staff member who is providing a bed bath using 4% chlorhexidine gluconate wipes. The options include A. The UAP uses a separate CHG wipe for each major area of the body. B. The UAP rinses the client's skin with water after applying the CHG solution. C. The UAP cleanses the client's face using warm water and mild soap. And D. The UAP allows the CHG solution to air dry on the client's skin. The correct answer is option B. The UAP rinses the client's skin with water after applying the CHG solution. This is incorrect practice and requires immediate correction. Chlorhexidine is a leave-on antiseptic designed to create a residual barrier that kills bacteria for up to 24 hours. Rinsing it off removes this protective layer and reduces its effectiveness. Let us now explore a medication safety scenario involving phenytoin. Question 73. The nurse is performing a medication reconciliation for a hospitalized client who is taking phenytoin for seizure control. The options include A. Thiamine, B. Prazosin, C. Warfarin, and D. Acyclovir. The correct answer is option C. Warfarin, because this medication poses a significant risk for interaction with phenytoin. Both drugs are highly protein-bound, meaning they compete for albumin binding sites. This competition can increase the active, unbound concentration of warfarin, raising the client's risk for dangerous bleeding. Furthermore, phenytoin induces liver enzymes, which may alter the metabolism of warfarin unpredictably, affecting the international normalized ratio. That is why the nurse should question this prescription. Let us now explore a developmental guidance scenario involving Erik Erikson's theory. Question 74. The nurse is speaking with parents of a toddler who are concerned about their child becoming more independent and prefer to assist with daily tasks to avoid frustration. The options include A. Your child may develop mistrust if not allowed to be independent. B. Your child may develop shame if not allowed to be independent. C. Your child may feel guilt if not allowed to be independent. And D. Your child may feel inferior if not allowed to be independent. The correct answer is option B. Your child may develop shame if not allowed to be independent, because toddlers are in Erikson's stage of autonomy versus shame and doubt. During this phase, allowing children to explore and make simple choices helps foster confidence and self-control. Overly assisting or discouraging independence may result in shame and doubt about their abilities. As we wrap up this session, let us examine a key concept from geriatric nursing. Question 75. During a continuing education seminar on aging and immunity, the nurse discusses changes in the immune system. The question is, which factor contributes to the increased risk of illness in older adults? The options are A. Increased lymphoid tissue volume, B. Increased autoimmune responses, C. Increased circulation of lymphocytes, and D. Increased production of T and B lymphocytes. The correct answer is option B. Increased autoimmune responses. With aging, the immune system undergoes immunosenescence, a process that weakens defense mechanisms while paradoxically increasing the risk of autoimmune activity. Older adults are more likely to develop conditions like rheumatoid arthritis and lupus due to a loss of immune regulation.